So what was your concern, sir?
Initially, she wasn't feeding well, and my wife was complaining a lot of pain, and probably the baby was biting onto the nipples, and she was developing a lot of cracks and pain and sore nipples. So that was a concern.
So how do you feel now after the procedure has been done?
Actually, I did a lot of research, and then I went on to a lactation consultant. If I have to explain the chronology of the event, the lactation consultant was the one who said, "Look, your baby has got a tongue tie or an upper lip tie. Both was there." While my pediatrician or the gynae who did the delivery, she said, "No, the baby is fine. You just have to keep latching correctly and put the complete not the nipple and the complete areola into the mouth. She would learn on her own." But the lactation consultant had a different opinion. She said, "No, your baby has got a tongue tie and lip tie. Please reach out to the doctors who can do a surgical procedure." So we came to Little, and the procedure was done in about 10 to 15 minutes. And post the issue, I went back to a lactation consultant to help us latch again, because that was it was not as simple as we thought. After that, within 24 hours, I see a difference in the way she latches and the way she feeds. My wife kind of says there is a lesser pain, and over 1 week we see an improvement in the way she feeds, while we will wait to see further improvement in the way she feeds and the impact of the procedure.
Is her latching better now compared to the previous?
Yeah, it is better. I would say it is latching is better, and her complete movement, the way she feeds, is better. Well, latching is better or not, I may not be qualified to, because I myself is not a lactation consultant. But what I can say is that the only parameter I apply to find is how quickly she feeds. Earlier she would feed for 40 minutes or 50 minutes, and then she would just hang on. Nowadays it is about 20 minutes, 25 minutes. Second is how much pain my wife complains. And in that she complains lesser pain. Probably it is because of the injury that has happened, because it's healing at the same time we are feeding, so it's taking longer than we expect. So these are the only two parameters I can comment. Probably a lactation consultant has to see it and say whether she's latching correctly.
So do you want to say something for the parents who have the same difficulties?
I wouldn't say that for the parents who have the same difficulty. What I would only say is that do not have a stereotype view that as a mother she should take on all the pain and then she should feed and the baby will learn, and the fault is always with the mother. For example, no, you don't have milk, or you don't know how to feed, you don't know how to latch, you should take on the pain. Give it a broader thought process. The problem could be with the baby only. Baby, maybe like in our case, we think it was the baby's concern. So give it a broader thought process, and probably you will find a better solution to feed, because breastfeeding is one of the best things you can offer your children. So I would say that way, give it an open thought process.